Okay, so first I'm just going to kind of address the situation with the physician. So the first thing I do if I was with a different patient and he came in and demanded that I see a patient in a different room while I was taking vitals, I would first be very apologetic to the patient and say, I'm so sorry about that. And maybe explain that surgeons have very stressful and careers and have a lot of pressure on them a lot of times, so not to worry about that. That I would handle it with him. But then I would go ahead and I would get the patient in a safe position to leave them, and then I would go follow up with the physician and just ask him if it's an emergency, what the cause was, and if he just wanted me in there because he was upset with the whole situation. I would try to kindly but firmly just explain that, I would say something along the lines like, okay, I'll be in there just as soon as I have an opening in my schedule, but unfortunately I'm already with this first patient and they're going to take my time because that's just the kind of therapist I want to be, where I prioritize time with each patient rather than kind of just jumping around and making anyone else feel unimportant. So I would just try to explain that, and I might get a little backlash from him, but we would just roll with the punches there. And then, so how it goes with, once I'm in room 12 and he comes in and he's very upset and then leaves after saying that that incompetence is all around him, I would discuss that with him later. Again, I'd be very apologetic to the patient, just say I'm so sorry about that. He's just got a lot of pressure on him, but we'll get it all worked out, and I'll talk to him when the time is right. And so I would continue my treatment with the patient, and then I would follow up and have a discussion with the physician. So how this is going to look is I'm going to talk to the physician first. We'll have our discussion, and then after that, we'll come kind of like reset, and I'll come in, and April will be the patient. So we'll start with that. Going to the physician, Carrera. All right.
Which side do you want me on? Just over here.
Huh?
Just over here.
You can be sitting.
Oh, am I in my office?
Sure.
Alright. I thought I was just standing around and huff.
Yes, waiting for me.
Yeah.
Okay, so I'll come in. Dr. Carrera, you know me. I'm Alex, student physical therapist. Do you mind if I have a moment of your time?
That's fine, go ahead.
So I just wanted to discuss some of the things that occurred in room 12 in front of the patient there. And I'm not trying to be accusative or anything. However, when you say something like incompetence is all around you, I feel like that really decreases my rapport with the patient, and I feel like it makes them feel kind of nervous about how they're treating. Do you have any thoughts on that?
I just don't have a lot of time. I needed to talk to you quickly. I need you in on that other patient. It's very serious.
I completely understand that, and we'll make sure that all the patients are getting the best care possible. But in order for that to happen, you can't disrespect me or anybody else in the staff like that, especially in front of patients. If you have a problem, I'm completely open to talking to you about it, but it needs to be in the correct place and at the correct time. Can we agree on that? Is that all right?
All right, that's fine.
Okay, and we can, I'm more than happy to hash it out, but it needs to be without sensitive ears.
Right.
All right?
Got it.
Okay, thank you. I appreciate it.
All right.
Okay, we're gonna reset now.
And now instead of
I don't know where you're going.
Because I'm being in person, I'm resetting.
Okay.
Now I'm a 51-year-old man.
Yes, I'm still gonna call him April, just so you know.
April.
Yes. Okay, so I'm coming in. April, I'm Alex. I'm gonna be your student physical therapist today. Nice to meet you. How you doing?
Hanging in there.
Hanging in there. So I hear we're having some things going on. So I know we had a surgery. Was that last night?
Yeah.
How you feeling today?
I've definitely felt better. I'm pretty rough.
And so I'm hearing we have some things going on with your right arm. So we're going to take care of you. I'm going to assess that, and we'll get you back to normal function. We'll work with you tirelessly until we can get you there. So don't be nervous about that. We'll take good care of you. I got a couple questions for you first.
That didn't happen.
Okay. I have a couple questions I just want to go through with you.
Okay.
Just to make sure that we're proceeding safely and to make sure that you're understanding, kind of, it's back and forth, so you get to know me a little better, and so we can kind of proceed with treatment just to make sure we give you the best care. Are you all right with that?
Yeah.
So the first thing I've just been looking through is, so we have some weakness on your right arm, right leg as well. Is that correct? Are you feeling any strange sensation like tingling or poking in there, or how does it feel?
It's just, I can kind of feel stuff, but it's just kind of numb.
A little numb.
It feels really heavy and just a little bit numb.
Okay. And compared to this side, to your left side. Sorry. How does that feel? Does it also feel the same way, or does it feel different?
No, it's really just my right arm and my right leg. I'm just feeling it on that side. The other side feels okay.
Okay. And so I'll look into that a little bit further after I finish up the rest of these questions. I just want to make sure we've got a list of medication here for you. Looks pretty extensive. Looks like we got you on the stuff we need. I just want to make sure, are you taking that as you were prescribed?
Yes.
Good. Alrighty. So I'm pretty happy with how things are looking so far. I think we're in a good shape where we can get you back where we need to be. I had another question for you. So with the heart surgery, I have an incision here. So something we need to follow is called sternal precautions. Have you discussed that with anybody?
No.
No? Okay. So pretty much what we need to do is, because we have that incision on the sternum bone, if we're moving too much around in here, that could cause some problems, give you some pain. So just a couple things I want you to make sure we're doing is you can't be moving your arms up above 90 degrees, and that's going to be right and left at the same time. If you need to, you can move that left arm, but just not at the same time. Above 90 degrees here, and like here, like we're flying. Okay? And then we also don't want you to be bringing your arm past your body, so going back like this at the shoulder.
Okay.
Can't be doing that. Can't go driving for a while, because if that airbag goes off, we're going to have some problems. And then there's a different method to coughing. Have you been able to cough at all? Yeah, I believe it does. So the method we're going to do, it's going to be a little tricky with our situation, but we want to kind of keep the arms in here and kind of do like a huff out. So it's not going to be like a, but it's going to kind of a situation. And we'll go through that again later on when we're doing a little more physical activity. But so those are the things we want to make sure. And then the last thing to note on that is there's something called staying in the barrel, where it's kind of, you want to pretend when you're moving around, you want to pretend like you're inside, like there's a big barrel around you. Pretty explanatory.
Okay.
So it means if you need to move around, we don't want you coming out like this and doing a big long reach. I want you kind of staying in the barrel, keeping the elbows at your side, and you kind of pick things up like this. If you need to move, you can kind of push yourself with your elbow as if you're still in that barrel, and that's going to keep you safe from re-injuring your chest, okay? Last thing, don't be lifting more than about 10 pounds, okay? Okay, good deal. And so I do want to start off just to make sure your orientation and awareness is where we need it to be. Can you tell me where you are right now?
Yep, I'm in the St. Luke's Hospital here in Boise.
Very nice.
And yeah, I'm just in my room. I don't know what room it is, but I know where I am.
And do you know why you're here?
Yeah, I had a heart attack yesterday and had.
Are you guys going to do it?
Yep, we're still doing it, buddy.
But
And can you tell me what day it is?
when are you guys going
Tuesday.
to start?
Shh, we're already started, buddy. You can keep watching your show for a little bit, okay? Or you can watch, but you gotta be quiet. Okie dokie.
But I don't.
And then can you tell me?
It's Monday.
Monday, okay. And can you tell me the date?
January 25th.
Nailed it. That's always a tricky one for me too,
Yeah.
so don't worry about it. I see on here you've had COVID.
Yes.
How recently was that?
About a month ago.
Month?
Got
Okay.
it from a coworker.
They're the best, huh?
Mhm.
Okay. And then this one's a little bit sensitive. Don't worry about it. But so I see that you have a history of constipation.
Oh.
Can you tell me more about that?
Not really. I don't think I have any more information on that.
Okay.
It's just I guess a problem I have.
Okay. That's just
Sorry, there's nothing else about it.
And I see that you also marked that you've had poor sleep lately. Can you tell
Yeah.
me more about that?
Yeah, I've just been struggling to sleep. I just feel like I don't know, I can't really get comfortable. It just seems to affect me most nights.
How long would you say it's been going on?
Let's see, probably about, hold on.
Let's just make it up if you need to.
Okay, a few months. I'm
Okay.
not sure exactly when it started, but it's been a little while now.
And it's just you're just restless. There's no pain or anything, or
No, it just seems like I can't stay asleep. I'm just kind of uncomfortable and
Okay.
keep moving around.
have you? And we can, if you want to, we can address that. We have a lot of things to get to today. So if we don't get to it today, remind me in the future, because there's some techniques we can talk about with exercise, your bedtime routine, things like that might help you. But We have just honestly some more pressing matters to get to. Hypertension, so high blood pressure. Can you give me like an estimate of years, how long that's been an issue?
Oh, it seems like it's been forever, you know, at least since, I don't know, my early 40s,
40s?
probably.
Okay, so like about 10 years or so?
Yeah.
Okay. And then tobacco use. Can you tell me more about that?
I smoke about a pack a day.
Pack a day.
Yeah.
Okay.
Can't seem to cut it.
Have you put any thought into quitting at all?
I mean, I've thought about it, but it just seems like, you know, it's part of my routine and it's hard for me to change, you know. So I haven't really put much effort into it.
Sure. And that's another thing like the sleep, we can address that. There's a lot we need to get to in a short amount of time, so we might not today, but we can definitely talk. If you're interested in quitting, again, you know, we got some resources for you. We can kind of try to identify the things in your life that might be, you know, causing you to smoke more than you normally would. So we can just kind of look through that and do some assessment. But again, up to you. You know, we're not going to force you to do something here. So, a couple things. I noticed we haven't got a whole lot of family history from you.
Right, okay.
Could you tell me? So do you have like so family history? Is like anyone in your immediate family had heart disease?
Not in my immediate family. No.
Do you know someone? Are you thinking of somebody or?
No, I don't think I can't think of anybody in my family. I mean,
Okay.
we probably don't talk as much as we should. So it's possible that it's there, but it's nothing that no one's ever told me about it.
Okay, sure. And what about cancer? Anything like that?
Nope, no cancer.
No cancer. Good. That's always a plus.
Yep. Talked about that.
Good. And then what about like a stroke? Anyone else?
Not
You
that I
of a
know
stroke?
of.
Okay. Good. Well, that's good. That's looking good for us. Perfect. Sorry, I got to get organized on these forms. There's so many words for my little brain. I can't be moving on, but that's okay. So I noticed you put that you have no interest in blood transfusions because of your religion. That's fine. We have that noted, so we'll make sure that doesn't happen. Respect your wishes there. Could you tell me a little bit more about your job? So what are your requirements at work?
I mean, I'm in construction, so I'm moving around, lifting heavy stuff all day long.
Have you had to guess how heavy? What's the heaviest thing you have to pick up?
Oh, I don't know. I mean, 60 pounds or something.
60 pounds?
Yeah,
Okay.
I mean, we do a lot of lifting together, though, so I couldn't really give you an exact.
And that's fine. Yeah, we're just trying to get a guess. What about like hobbies outside of work? What are things you want to get back to after this?
I've been golfing the past few years, and that would be really nice to be able to get back to that.
Better man than I am. When I go golfing, I might as well just call it, you know, going out and swearing in public. That's all that really happens. But. So I noticed that you're living with your wife.
I am, yes.
Tell me about that. How is she handling things right now?
Well, I mean, she's obviously very stressed. She still has to work though. She teaches over at the school,
Mm-hmm.
and so she's at work right now. But I mean, there's not much we can do about it.
Yeah, that's life,
Yeah.
unfortunately.
Mm-hmm.
How do you feel like she's supporting the needs that you have?
I mean, as soon as she gets home from work at night, she's able to help me.
Perfect.
She does work, you know, full time, but in
Right.
the evenings, she's definitely there to help.
Okay, good. I'm glad to hear that you at least have someone there with you. And tell me a little more about your home. Do you have stairs in your house at all?
Yeah, we have some stairs inside our house. It's a full flight. It kind of tilts halfway through. And we got railing on one side going up there, so that'll be good. Don't really have rail on the other side.
So to get into your home, do you have to go up any stairs?
Yeah, actually, I have about 4 or 5 steps that go up into the house. Again, I have a railing there, but it just on it's on both sides. They're just too far apart, though.
Okay.
I can't really lift myself in there very well.
Sure. Okay. And what about pets?
No pets.
No pets.
Me and my wife.
Okay.
All the kids moved out, so.
They ditched ya.
Finally.
Are they living close by?
No, they're out on the East Coast, actually.
Ooh.
Yeah.
What are they doing out there?
Trying to get away from me, I guess.
Oh no. Well, yeah, you know, that's the problem with kids is you're not really sure if you want to hope for that or not.
Are
But
you guys doing it now?
perfect timing.
Sure,
Yeah,
yeah.
we're going, but you're doing great. So yeah, you mentioned that you haven't been talking to your family much.
Yeah.
Could you tell me more about, so is it our specific people, parents, siblings, your kids?
It's really just like I said, it's me and my wife. You know, I mean, she talks to the kids regularly. They're just all out living their own lives, and
Right.
I got a brother in California. He's I don't know, recently divorced, doesn't seem to want to talk to anybody that much. But
Sure.
other than that, you know, my parents are dead, and so it's kind of just me and my wife.
Sure. But at least it sounds like things are good there with her. And
Yeah, yeah, she's great.
well, I think that's the most important thing.
Right.
So moving on, that's the majority of the questions I wanted to ask you. So we'll kind of dive in a little bit more. So I guess before I start anything else, I just want to ask, how are you doing emotionally? How are you feeling right now?
You know, I mean, I don't know what I can be doing. It's kind of everything just happened so fast. It's like Saturday night, I wasn't sleeping good, and all of a sudden Sunday, Sunday I was.
Get up, yeah, continue.
Oh, why?
We're just recording a little video here, okay?
We'll be done really soon.
Yeah, you're doing a great job.
Awesome job.
But I don't want to stay
Just-
on the blanket.
Okay, just try not to talk too much, okay? Just try and be nice and quiet so they can hear our video.
Anyways, it just all happened so fast. It was like Sunday, I just all of a sudden was having some chest pain. My wife thought it might be a heart attack and rushed me to the ER, and then was in surgery, and here I am. It's just been kind of a whirlwind, and it's kind of, I mean, I don't really know what's going to happen here on out, so just kind of trying to deal with it one step at a time, I guess.
Yeah, well, thank goodness for your wife for picking up on that.
Yeah, smart lady.
Yeah, sounds like a good one. So we have a lot of resources here at the hospital. If you're interested in talking to somebody about your mental health, do you have any interest in that right now, or is it just kind of too much? Okay, that's totally fine. If something like that comes up, feel free. I'll see you quite a bit before you're out of here. So if anything like that starts to concern you, let me know. We can get you the right people. Okay.
Yeah.
All right. So moving on. There's a couple things I want to look at for you. So I want to kind of just do a general evaluation or examination of how your physical body's doing, just to see, confirm what we know, and then maybe cross out anything that we're worried about. Okay, is that all right with you?
Yeah, that's fine.
So the first thing I want to do is I just want to see how much this right arm is moving and that right leg is. So just to give us something to reference, could you just, with left arm, just move it up as high as you can? Okay, and then make sure we're not using the two. Okay, and that's the left arm. And you're having some pain there. What's going on?
It just hurts to move it.
The arm?
Yeah. Yeah, it's just with that incision, it just kind of pulls on
Okay.
anything I do.
Sure. So we'll try and kind of keep it in a little bit.
It does feel fine, my hand. It's
Yeah,
just
the
that
pain.
movement. Yeah, it's
Totally
just
get
pulling
it.
on
That's
it.
fine. And how about, don't go too far, but just keeping the elbow bent just a little bit with the other arm. This arm
This
still.
one,
Sorry.
Sorry.
Yeah, you're okay. A little bit there. Okay, again, don't push too far past that pain in the chest. Okay, back down for me. And how about with this arm? Can you get any movement there? Good. Hey, that's not bad. That's pretty good. Day up. How about moving to the side? Obviously, we're a little bit in the way here. Okay. Good. Got a little bit of movement here. How about here? Just at the wrist. Okay. Other side for me. Okay. Continue to flex those guns. Nicely done. How about on the other side? Okay, good. That's good. How about, let's move the leg. Lift up the left leg for me as high as you can. Good. Feeling okay there. And stick her out for me. Good. And I'm going to give you a little push here. Good. And how about toe up for me? Yeah, you're fine. So bring that toe up. Good. And now just that big toe for me. Bring her all up. Sorry. Good. Okay. Now point down for me. Good. Now let me move you. Hold. Good. Now let's try with this side. Just try and lift up that leg. Like that. Good. And now kick it out straight for me. Watch out for the child. Okay. Good. Hey, that's not bad. Now let's just bend that ankle up towards the sky. Okay. Push on just a tad bit. Okay. And now toe for me. Okay. And now Pick her up. It's good. You're getting a lot of movement there. That's very encouraging. That means we can kind of get you moving and get stuff working for you. So that's a very good sign. Next, we kind of talked about how things are feeling. So I'm just going to do something where we have you close your eyes, and I'm just going to tap, and I'll just be kind of like on your arms, and then kind of on the sides of your legs and on your feet. And I just want you to tell me if it feels the same on both sides or different. Is that okay with you?
Yes, that's
Okay. So we'll just start here. Here, same or different? Same or different? Different for both, or
Sorry, for both.
you just done this too many times?
Both. I know, yeah.
Okay. There.
I mean, I can't feel it as well on my right
Okay,
side.
that's just fine. How about here?
It's kind of the
Still
same.
different. Here. Different. And then on the inside, it's different. Okay. We're gonna move down to your legs now. So I'm just gonna start on the inside of your thigh, just right about here. Same or different?
Still can't feel it quite as well
Okay.
on my right.
There. Okay. Excuse me, Mr. William. Same or different? Okay. Same or different? Go back to you. And so you're still feeling it. It just doesn't feel the same.
Yeah, I can feel it. It's just kind of, just a little. It's just kind of numb. It just feels
Sure. Okay. Not quite as strong pressure.
Yeah.
Okay. Good. Thank you for doing that with me. So, excuse me. Moving on, I just want to take, if it's okay, I want to take a look at that incision just to make sure we don't have any abnormal redness. Make sure it's looking okay. Is that all right with you? Okay. So we'll just take a little peek. Look in there. Looks good.
Sorry.
Don't break character, madam.
Sorry.
Okay. Well, I'm glad to see that things are going there. How does breathing feel for you?
It hurts.
Yeah.
It's really bad. I'm trying to. The nurse tells me I need to take deeper breaths, but I can't seem to get much air in because it just hurts too bad.
And on the chest.
Uh-huh.
Okay. And that should fade in the next few days here. Hey, come on, whoa. How about, so something we can do for that is kind of that same thing again, hug that pillow, get it kind of closer in there, and breathing with the pillow, your chest should help relieve a bit of that pain. Do you feel any like shortness of breath, anything like that?
No, I can't breathe
You can't
in
breathe it in
deep
deep enough?
to
Sure.
even check it.
How about, so we kind of talked about there's a bit of constipation in there. Any stomach pains that you don't feel like are affiliated with that?
No.
No, doing okay there. Urination, the bathroom, since it's happened, I imagine we probably have you on a catheter. Were there any issues before this?
No.
No? Okay, good. Well, it looks like we're doing pretty good. We talked about sleep and anxiety kind of things. So the next thing we'll do, so this part's a little tricky. So typically I'd have this just kind of up on the wall. We'd have the monitor for us here. So we'd be looking at, I would take vitals, make sure we're safe. Probably again, we'd have this up on the wall so I could take a look at it. For the documenter, it's on the exam stuff. So if you want the values, go ahead and take a look there. So next I want to hey buddy, stay out, kiddo. So I looked at the labs. Labs are looking okay. The one thing I want to mention to you is it looks like cholesterol's a little high, and then just the amount of fat in your blood's kind of high. Could you describe your typical diet for me?
I eat pretty much the same thing every day.
And what's that?
Eggs and bacon, hash browns for breakfast.
Oh yeah.
For lunch, I usually take leftovers, where we do a lot of, like roast beef and and meatloaf. I just kind of, we love red meat in our house, but that's pretty much all I eat.
I can respect that. Growing up, we did a lot of hunting and everything like that, so it was, if we had a meal, there was going to be red meat in it. So that's okay, but maybe consider, and I don't want to tell you how to live your life, so, this is just some advice from a friend, maybe just up the vegetable intake a little bit, So there's something called the plate method, and you don't have to be this extreme at first, but you do half of your plate is vegetables, a quarter is meat, and a quarter is a carb or something. So to me, what it means is half is vegetables, half is the good stuff. And you don't have to start there, but maybe start with quarter of the plate is vegetables, or an eighth of the plate, just some vegetables, and then try and build up. That'll bring down a lot of the problems with fat and cholesterol that we're having. Okay. Again, don't have to, but it would be good for your health. Okay, so moving on, I just want to take a couple couple tests. So this is what we're going to do next is just going to be ways that we can kind of see how we're improving. And so what they're called is like test and measures. And so what I'm going to do is I'm going to listen to your lungs. I'm going to listen to your heart. And that's going to kind of give us somewhere to compare for the future of how well we're doing. And if, you know, those sounds are starting to sound better or sound worse, so that we kind of know we have a baseline to see how you're progressing, okay?
Okay.
Perfect. So we'll start with that. And so it is going to kind of involve, I need to go here, and so we're going to do little boxes around on you.
Okay.
And so it's going to kind of be a little, go around like the chest and on the ribs. Are you okay with that?
Mm-hmm.
I'm not going to expose my wife, but, you know, if the patient was in, you know, a gown or something, I would ask if they're okay with me going under the clothing. So consider yourself asked.
Cool.
Okay, so we'll start with that. And do you mind if I kneel right here, just to kind of get a little closer? Okay. So go ahead and just give me a deep breath in and out, just as much as you can. Don't hurt yourself, just within reason here. Okay? In and out. Good. And here. In, out. In, out. Okay. And April, as a woman, do you mind just kind of moving your breast tissue just off to, like, kind of towards the center for me just a little bit? Thank you.
Oh.
Good. Yeah, we just got to get to like the 4th to 6th rib, so out in and out. Good.
Sorry, I didn't.
In.
See.
You're okay. Out. Good. Over here. Trying to do the square method, but I'm failing miserably. In. Out. Out there. In. Okay. Pain with the incision.
Yeah.
Right, I'll try to be a little careful on you. So next, I'll be pretty careful when I listen to the heart. So there's 4 spots I need to tag on you, just kind of around that left chest, left breastish area. Are you okay with that?
Mm-hmm.
Okay, it's not going to be much different than before, but you don't have to breathe in and out for me, so that's kind of a positive.
Right, good.
And I'll be careful on that incision. Go right next to it there. Good. And over here. Good. And then if you could kind of just move some breast tissue again, kind of towards the middle for me.
Towards the middle?
Yeah. And then maybe up a little bit. Good. Good. All right, and for the documenter, once again, that information's on the sheet for you. We have like wheezing, I think it's wheezing in the lungs, and then lower we have, I think so. Am I making this up? Anyways, yeah, there's some findings. You can take a look at them in there. Things we'll hope to resolve with movement, with therapy. Good. So, moving on. How much time are we at? 28 minutes. Hey, we're in good shape here. So, if you had to rate your chest pain right now, not necessarily from the sternum, but like how, like, do you have any like pain in like your arm, your chest, kind of like heart pain? If that's a terrible description. Do you have any pain in your chest right now other than the incision?
Yeah, there's still some kind of lasting pain. I put it at maybe like a 7 or something.
A 7? Okay.
Very uncomfortable.
So if you had to say, is it like barely noticeable, moderately noticeable, severely noticeable, or like so bad you can't stand it right now?
I'd probably put it at severely noticeable.
Okay. So, okay, that's just fine. We'll get that documented for you. Obviously, we hope to decrease that. And how about, like, feel out of breath at all right now, or is it still just because you can't get the deep enough breaths?
Yeah, I just feel like I can't breathe in all the way, and so, you know, there's that need to breathe, but I just can't, you know, it just hurts so bad every time I try and take a deep breath. So.
Sure. And how about, so just kind of rating on how, like, out of breath you feel. Because of that, would you say, kind of same thing again, barely noticeable, moderately noticeable, severely moderate?
Probably moderately noticeable.
Okay.
That's not my biggest concern right now.
So that's going to be a 2 plus, I think 2 plus on the dyspnea scale, and then 4 on the angina scale for the documenter, or 3 on the angina scale, sorry. And then I just want to take a look. One of the last things I'll do is I want to see something called pitting edema. It's just see if we have any swelling in the leg. I'm just going to push on you and see if we leave an indent, and if so, how long it takes for that indent to come out, okay? So we'll go ahead and do that. Do you have any results on how long? So we'll say to the documenter, we'll say we'll mark it at a 2. So it'll take about 30 seconds to go away. Or no, sorry, 2 is 15 seconds. So we'll do a 2 still. Okay, so the last thing I want to do is I just want to see if we can get you standing a little bit. How did you get into this chair? How did they get you here?
The nurse came over and helped me into it.
Okay, and were you able? How did you feel? Like, did you feel dizzy? Did you feel unstable?
I just can't really lift myself up very well. You know, it's hard to use my arm. It's feeling so numb. And the other one's hurting me, so I don't really feel dizzy, but I just don't have a lot of movement because
And so, the reason we're doing this is I just want to monitor how your vitals change to it, and I want to monitor if your chest pain is worth standing.
Okay.
Having said that, how do you feel about standing up and just seeing how long you can stand for? Do you feel comfortable with that?
Yeah, I can try it.
And so my wife is pregnant, so I'm not going to put a gait belt on her, but we would put a gait belt down, make sure that we're away from the incision, making sure that we're safe with it, not getting away of any tubes. So the big thing here is remember that we can't lift 10 pounds. That also means body weight. So I'm going to put a walker in front of you, but what I want you to do is I want you to kind of scooch forward on this chair, and I'll help you get there, but we want the feet kind of under the knees, and we want most of the weight coming from the legs, okay? If it gets to the point where you can't get up without pushing, I'll give you a little bit of help, but I want you to do as much as possible, okay? And again, I need you to communicate with me if you're feeling any dizziness, any nausea, any kind of unbalance, if you feel lightheaded, any kind of change, let me know, and we'll get you back in your chair, okay?
Okay.
So first things first, we'll just have you, we'll get the gait belt on you, again, baby.
Do you need to flatten that before I go over?
I'm not going to have you sit on the table, actually.
You're having me stand up.
Yeah, I'm just going to be stand for as long as you can. So let's get you, I want to see how much you can do. Again, it's going to be kind of, we don't want you putting too much weight through your legs, or through your arms, excuse me. So if you can kind of scooch from one side to the other, so if you can do kind of a there, and I can help you if you're comfortable with that and if you need it. How are we doing here on that incision?
Okay.
Okay, so we got our gait belt. I'm going to pretend we're grabbing onto that. Okay, so, yep, pretend walker. And again, this is for balance, but we don't want you to put any weight through that. So let's get those feet under your knees a little bit and kind of get to a spot where we can lean up. Good, and stand. Good, good. How you feeling now?
Feel okay.
Yeah?
Yeah.
Dizziness, headache, lightheaded?
No.
Okay, good. We'll just stand here for about a minute or so. I guess you probably don't have any. So, do you have any information on if you start feeling lightheaded and steady? That's fine. So we'll say she's tolerating it pretty well. There are some changes, increases in heart rate and blood pressure, but within normal measure. Happy with that. So the next thing I want you to do, since we're tolerating this, okay, we'll kind of get into treatments next time, but I want you just to kind of slowly rock a little bit, just ever so slightly on that right leg and back to the left, to the right, back to the left, the right, to the left. How are we feeling here? That's really good. That's a really good sign for the condition you're in here. Being able to put weight through that right leg and that arm, very good signs. I'm very happy about that. All right, well, let's call it a day. So we'll sit you back in here, kind of the same way that we stood up. Okay. So not too much weight on those arms, just kind of give me a good little squat there. And I've got you here.
I might need some help.
You okay? All right, gotcha. And gait belt would help. Okay, so how are we doing?
I'm doing okay, yeah.
Good. Well, I've said a couple times, I think you're in good shape. I think we'll be able to help you quite a bit. So the last thing we need to just talk about really quick here is just where we're going to send you after this.
Okay.
Because you have the stairs outside your home, I'm a little nervous to send you home in a couple days because your wife's not going to be there most of the days. It sounds like getting into the home is going to be a challenge for you if she's not there to help you. And I mean, even if she's there, that's still going to be pretty tough. Is your bedroom on the first floor or the top floor?
On the
second floor. So I mean, unless you want, I mean, even I'm nervous about the conditions already, but you know, if we had you know, if we sent you home soon, you'd have to be sleeping on a couch or on an air mattress downstairs or something, because it's going to take us, I think, a bit before you're 100% ready to use that leg going up some stairs. So I think what I would be thinking right now, because his wife is working and he won't have someone with him all the time, I would probably say we need to send you to inpatient rehab for a little bit. So what that's called is we'll keep you in the hospital, but you're not going to be in the intensive care unit or the acute care floor. It's going to be another floor where I think it'll be really good for you, because you get about 3 hours of treatment a day, and that's going to help you with the stroke symptoms you're experiencing, as well as with your heart. They'll have a lot of time to help you out there. And again, that'll just be a little bit until we get you safe enough to be going up and down at least 4 sets of stairs. How are you feeling about that?
Well, I mean, I don't really want to, but I also don't want to be a burden on my wife. I mean, she's got work, so.
And I mean, the biggest thing is it's just a safety issue. You know, if you had a fall without her around, like, you know, with the sternal precautions, everything like that, we'd be in some trouble. But like I said, you're in good shape. I think we can get you moving pretty well pretty soon, and we'll get you back home. Okay? Any more questions for me?
I don't think so. I'd kind of like to get back into bed if possible, but.
Oh, sure. Yeah, absolutely.
Other than that.
Kind of wiped out there.
Yeah.
Yeah. Well, probably should have done that in the first place while we had you standing up, huh? That's okay. Looks like you got some good strength. So what we'll do is, obviously we'd have a hospital bed that would go up and down, so we'd lower that for the patient. And we'll just kind of do what we did, where we stand you up, and then we'll kind of just have you point. Point is a weird way to put it. So we'll get your foot pointed this direction for me before we stand you up, so we can kind of just do a little spin and sit down, and then we'll get you in there. Again, remember keeping those arms in the barrel for me, using the legs. I'll help you here in case you lose balance, but this is something that I want you to do as much as you can for me, okay? And then how are we feeling? I know you needed to...
You can't be on that part when it's out.
That's just for somebody's head. Okay, so again, hey, we're going to put Mommy in there, so just leave it there for a minute, please, okay? Hey. Okay.
It's okay, we're almost done, but you're doing great.
So, I just want to make sure, not feeling too dizzy, feeling all right, feeling like you can handle stand up for a minute.
Yeah.
Okay, let's do it again. I'm not going to grab on your arm for you because that would put too much pressure through there.
Okay.
I'll get that gate belt on you again. Blah, blah, blah. Same kind of deal here. Get those feet under you.
Okay.
Okay, good. Up you come. Good. All right.
Okay.
Now, can you pick this foot up at all here and kind of turn it?
A little bit.
A little bit. Okay, good. And now we're just going to ease your step back. Take a step back towards the bed, if you can.
Okay.
Good. Alrighty, and I've got you here, so now just kind of swing those legs up if you can. Again, careful, whoop, 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 whoop. Careful with the arms.
Oh, okay.
You're okay. And good.
Can't really get them up there.
You're alright? Okay. Alrighty, well, we'll be seeing you tomorrow, okay?
Thank you.
Sounds good. We'll see you. We'll come do some more torture, okay?
Sounds great.
Hang in there. It was nice meeting you.
Thanks.
We'll see ya. That's the good arm, right?
That's
Okay. All right. That's a wrap, people.